This week on Top 3 Tuesday, we're talking about hip pain with rotation. Hey, this is Dr. Andy and Dr. Brandon with Twin Cities Movement, your Minneapolis chiropractic and functional rehabilitation center. So this week on Top 3 Tuesday, we're going to talk a little bit more about hip rotation and how hip pain plays into multi-segmental rotation. So if you remember last week, we talked a lot about the spine rotation and limitations in the spine. And so this week, we're going to continue that with how that looks in the hip. So we're going to start with a really quick review of the top tier assessment that we did last week. So we'll have Dr. Brandon rotate to the right. So we want to be able to see his other shoulder, which we can't. Maybe we can from that camera angle, but I wouldn't be able to in the examination because he is restricted to that way. So we go into a little bit more, and then we do a little bit of more assessment, assessing rotation a little bit this way and a little bit this way because it looks different. Of course, you're on the table, you've removed all these things. And then we'll go into the soft tissue work and loosen up any of that with manual therapy. We're going to loosen up, the external and internal hip rotators a little bit if that's necessary. And then we're going to go into a seated position, into the 90-90 shin box position here. So we call this 90-90 because there's a lot of 90-degree angles. And I'm pretty sure you've seen this before if you've ever watched Top 3 Tuesday because we cover this one a lot. We really love this stretch. So we're gonna have Dr. Brandon keep a straight back, keep his chest up, and lean into that stretch. And you're gonna see that basically stretching this leg in this area here. You're gonna feel that quite a bit. Then we're gonna have him rotate. And so then he's going to feel that on the inside of this leg. And so this is going to get, when you do both sides, you're going to get internal and external rotation of both hips. So it's pretty good. It's pretty solid. Okay, and then the next thing that we're going to do to add a little bit of challenge onto that is we're going to get onto all fours. And we're going to have Dr. Brandon stick out one of his heels to straighten one of his legs. And he's going to rotate his leg to toe out, moving his pelvis as little as possible. And then you're gonna do the same thing, toeing in, again, moving pelvis as little as possible. So this is about controlling hip rotation at the hip. So this is really, really nice for that. He has a little bit of trouble on this side, not as much trouble on the other side. Totally cool. Doctors are human too, so we get to have these problems as well. So then the last thing that we're gonna do is weighted rotation. So Dr. Brandon is gonna start with the kettlebell in the middle here. And he's going to start by looking to one direction, turning his trunk to one direction, and then transferring the kettlebell into that direction. Controlling this slowly. You are making sure that you're staying tall the whole time that you're controlling this, and you're not really using your arms very much, just to transfer the weight a little bit. Okay. So this was Top 3 Tuesday, talking about hip rotation control, and ways that we manage hip pain in the office. If anybody has any questions, they can shoot us an email, shoot us a message on Facebook. Feel free to subscribe to our YouTube channel where you can see plenty more of these videos, plus we release them every week. Or you can subscribe to our email newsletter where we will give you this video and lots of other useful tidbits of information to your inbox once a week. Thank you so much for watching.